this webinar. Welcome everyone to the American Lung Association's Community Connections presented by Novant Health. I'm your host, Carrie Beal, health and wellness reporter at Spectrum News. A few housekeeping items before we begin. This webinar is being recorded and will be available after the session. Please submit questions for all of our panelists through the Q&A button. We will do our best to answer the questions at the end of the session as well. We encourage everyone to complete the survey at the end. This will help guide us as we create future sessions. Today's discussion will focus on asthma and the impact of air quality. We are fortunate to have state experts on today's panel to guide us through this discussion. We will do a brief introduction of our speakers since you received their full bios in the confirmation email. So with us today are Lisa Cutshaw, she's the respiratory educator at Novant Health. Kirsten Miner, she's the health manager at Clean Air NC, and Marcus Hill, he's the chief information officer for Rogers Builders, and he's a lifelong asthmatic. Roughly 1 in 13 Americans have asthma, which is about 25 million people. It causes thousands to miss school and work days. Asthma is the third leading cause of hospitalizations among children, and there is no cure for asthma, but it can be managed and treated, allowing individuals to live a normal, healthy life. Let's open the conversation with Lisa as a respiratory educator. Help us understand what asthma is and why people get asthma.
Thank you, Carrie. Asthma is a chronic inflammation or swelling inside the tubes within your lungs. The swelling causes extra mucus in the tubes, and the muscles tighten and squeeze around the tubes. The most common reason for getting asthma is a sensitivity to things that may not bother other people. These are often referred to as triggers. Chronic exposure to triggers can lead to uncontrolled asthma.
Thank you so much, Lisa. And Marcus, you've been living with severe asthma since you were very young. Tell us what it was like growing up in rural North Carolina with asthma, and how did your asthma restrict your activity as a child?
Yeah, I was, when I was born, I had severe eczema, and the doctors told my parents it would probably turn into asthma when I was about a year old, which it did. They lived in a small one-bedroom house. It was old on a dirt road, so we had issues with mold and dust. Some of my first memories are riding in the middle of the night to the hospital because my lips had turned blue, and going to the hospital to get adrenaline shots so that it would, get me breathing again. My parents were faced with a tough decision. Either they could stay in the house they were in, or move, and they chose to move, and we moved into a mobile home when I was about 4. My health improved considerably after that, so I wasn't going to the doctors nearly as much, especially in the middle of the night, but I still had issues. As a child with asthma, I missed a lot of days of school. Colds were more like flu, took lots of time. I think, and I had to be very careful with environmental factors. I think one of the things that is, the physical issues I think are generally understood about asthma. I think a lot of the social and emotional issues that kids, particularly dealing with asthma, are learning how to navigate a world where, because for me, I couldn't spend the night with friends, I couldn't go camping. I had to be very careful around people who smoked, which in the 70s and 80s was very difficult. I remember as a teenager finding a shed with all the stuffed animals I'd been given as a kid that I couldn't play with because of the asthma. So living with asthma, you really have to learn how to gracefully navigate social situations in a way that you're politely turning down invitations and stuff without hurting other people's feelings, because a lot of people just don't understand kind of the impact.
Wow. Yeah, that was very interesting to hear about what you had to deal with, sacrifices your family had to make. Thank you so much, Marcus. Lisa, what are some of the primary triggers that our audience should be aware of?
The most common triggers are smoking, stress, exposure to colds and viruses, infection in the lungs, ears, and sinus cavities. Occasionally, someone will be allergic to a medication, strong cleaning products, perfumes, air pollution, exercise, and even very cold air. Those are one type of trigger. Another type of triggers can be something you're directly allergic to, like dust mites, mold, cats, dogs, pollen, grass, weeds, cockroach droppings, and mice. Triggers can vary from person to person.
It's good to know. And Kirsten, Lisa mentioned environmental factors, including pollution. Help us understand the different types of pollution and what is the difference between particulate matter and ozone, and what do you see as the primary factors affecting air quality in North Carolina?
Thank you. So when we speak of pollution, we're speaking about greenhouse gas emissions, which stem primarily from the burning of fossil fuels. So that's oil, gas, and coal, which creates pollutants such as particulate matter and ozone. The difference between particulate matter and ozone, again, they both come from the burning of fossil fuels, but ozone is created by a chemical reaction between nitrogen oxide, which comes from our burning of gas, so our exhausts within our car systems, but volatile organic compounds, or VOCs as we refer to it. Again, it's emitted from our exhaust pipe within our cars. And when that combines with heat and sunlight, it creates ozone. So on a poor air quality day, when we think about ozone and, on hotter days, or even just a hotter portion of the day, envision a road where there's a lot of cars on the road, rush hour traffic. It's a super hot day. You're surrounded by cars, trucks, etc. You may actually be able to sometimes see ozone because it creates a smog or a haze. Whereas particulate matter, it can vary in size. So we focus on PM10, but specifically PM2.5. PM2.5, even though it is an actual solid, it's something that it's so small we can't see it. It's so fine. So again, that comes primarily from fossil fuel combustion, but it can also come from agriculture and construction, the wear and tears from our tires, and burning of wood. So early mentioned campfires, for an example. But PM2.5 is dangerous because even though we can't see it, we breathe it in. And when we breathe it in, it can attack the lungs, as well as it can actually, it's so small, it can pass into our bloodstream. And when it passes into our bloodstream, it can actually attack all of our major organs. So it's a huge threat to our health. And in fact, for the top 5 leading causes of death in North Carolina are caused or exacerbated by particulate matter pollution. And you asked, what is the primary source of pollution within North Carolina? Number 1 would be our transportation sector, followed by our electricity or energy sector. And then number 3 would be in industry, so our industrial sources. And I would recommend individuals, they can check out the American Lung Association State of the Air Report to really learn more about the disproportionate impacts and threats that both ozone and particulate pollution can have on the health of all of us.
And most asthma is allergy induced. What impact does the climate have on those asthma incidents?
Yes, so climate change, actually, it's the World Health Organization has identified as the greatest threat to our health. Climate change is actually worsened by air pollution, because when we speak about climate change, we're thinking about increase in heat and increasing temperature. And with increasing heat and temperature, we have longer allergy seasons. So of course, we have longer allergy seasons, individuals with asthma. We spoke about environmental triggers like pollen. That means that they have an increased exposure and frequency to those environmental triggers that can lead to exacerbation of asthma symptoms, including asthma attacks.
It's good information to have. Marcus, let's go back to you. The pandemic, it's been particularly concerning for you. What precautions did you take during COVID? I understand they were pretty drastic, right?
Yeah, they were. I think we were all dealing with a lot of uncertainty, and I think out of a preponderance of caution, my primary care physician recommended that I worked remotely about a week before kind of the rest of the world did, which was good. And then we also had some exposure in my household as we went through the pandemic before we had a vaccine. So I ended up actually spending 3 months isolating by myself down near the coast. And that really helped in a number of ways. Primarily, the air quality near the coast of North Carolina is extremely good. So it allowed me to get out and work on physical fitness, building lung capacity, and just kind of taking myself out of risk. As soon as the vaccines were available and I got fully vaccinated, I returned to the office. But having that time away really kind of made it helped tremendously.
And that's interesting that you mentioned the coast, because I know in some mountainous cities like Salt Lake, the air quality is worse during certain months because it gets trapped in between the mountain regions and the valley. And the coast is a good example of how, anything can get spread out and not trapped in there.
Exactly.
So, Lisa, how could COVID impact your asthma patients?
Carrie, people with asthma are at an increased risk of getting COVID. If you get COVID and you already have asthma, you're at risk for developing a more severe case of COVID and requiring extensive care. And that extensive care could include hospitalization and even intensive care or life support. Personally, I've had 2 friends with asthma and both contracted COVID and both had to be admitted to the hospital. We have seen that after COVID and asthma, that it may take up to 6 months to 1 year to regain full control of your asthma. And that's if there's no permanent damage.
Good to know. And let's talk a little bit more about air quality and how some populations are more adversely affected. Kirsten, we know Black, Hispanic, and Indigenous people are disproportionately burdened by asthma. What environmental factors contribute to these disparities?
Well, as a public health practitioner, we use a term called social determinants of health, which refers to where a person lives, works, plays, and prays, and what's in their surrounding environment. So when it comes to where people live in the United States, we have to acknowledge history and the role that systemic policies that were discriminatory played in shaping the neighborhoods in which we live. So you may have heard a term called redlining, and I'll explain it for those who are not aware of it. Redlining was a discriminatory practice that did date back to the 1930s, where the Homeowners Loan Corporation developed these maps. And these maps determine the status of the neighborhood, and the map used a color code. So if it was green, it was considered the best neighborhood. If it was blue, it was considered still desirable. If it was yellow, it was considered declining. And if it was red, it was actually considered hazardous, hence the word redlining. So Black, Indigenous, low-income communities were disproportionately placed within those red line communities that were indicated in that map. And those same areas also have a hyper concentration of industrial exposures. So when we think about, I'll use both urban and rural as a compare the two. So in an urban setting, that may look like the intersection of the highway system, such as interstate, major highways. Of course, what's on those major highways can be large trucks that emit diesel emissions, and even just your regular, rush hour traffic. So that is what it may look like in an urban setting. And of course, in urban settings, that can be factories and etc. In a rural setting, that may look like in regards of where people live. It could be, we think about coal sites where we're coal mining sites located as well. So with that being said, if people are living low income and then people of color are concentrated in those areas where there's just a greater exposure to those environmental pollutants, that contributes to a variety of health disparities, including asthma.
Yeah, it's one of the dark parts of our history. And outside of air quality, what factors contribute to higher rates of asthma among minority populations?
Is that still for me?
Yes, still for you, Kirsten. If you can answer that. Can you answer that question?
Yes, I'll reiterate in regards, if you just happen to, if you live in an area where there's just a greater exposure to pollutants from industrial sources, then that is of course going to worsen your air quality. And of course, if it's worse air quality, it's going to worsen a variety of health outcomes that could be heart disease, other respiratory conditions, including asthma.
Okay, thank you so much. And Lisa, are you seeing demographic differences among patients, just from your own patients or data?
Yes, we are, Carrie. So typically when you look at asthma, you see a couple big age populace. You see middle-aged adults, so that's going to be your 40 to 60-year-old adults. And then you see early school-age children, that 4 or 5 to about 10 years old. In North Carolina, asthma is more common in rural areas and in the poorest counties in North Carolina. In rural areas, we've discovered that there's less access to doctors and asthma specialists. Other known contributing factors are the fact that there are poor housing conditions. And as we mentioned before, when you have poor housing conditions, you have more of the common triggers for asthma, mold, which are mold, cockroaches, and mice.
And managing asthma is really critical. What are the best strategies for doing that?
So the best strategies for managing asthma is to know how to correctly use your asthma medications, when to use each medicine. You need to know your triggers and how you're going to control those triggers, and to make sure that you have an asthma action plan that has been created with your doctor or asthma specialist. Having this plan in place will guide you in managing and treating your asthma.
And currently, what are the most common treatments for asthma patients, and have treatment options changed or improved over the years?
So the most common treatment options are still quick relief inhaled medications and inhaled steroids. I think it has changed over the years. You now see more types of medications available for patients who have asthma, and these medications help treat and control asthma and the triggers. Some of the newer options that are out there are definitely combination inhalers, biological injections, and bronchial thermoplasty. As with any treatment, you want to talk to your doctor to find out whether this option would benefit you or not.
Yeah, some of those I've never even heard of. So good information.
Thank you.
Kirsten, how do you recommend individuals protect themselves on poor air quality days?
Yes, so on poor air quality days, we recommend individuals to, one, most people, if you have a smartphone, it doesn't matter if it's Android or an Apple, you have a weather app, and within that weather app, you may actually see that it'll tell you about the air quality index, or it'll even tell you what the pollen level, if it's low, if it's medium, if it's high. So what we recommend is to check the air quality index on the day, because that's how you'll know whether it's a poor air quality day or if it's a good air quality day. If you see on your phone that it's a poor air quality day, then I would recommend you to plan out the activities that you do throughout the day. So let's say if you're a person who you enjoy exercising, if you're a person who exercises, I would recommend on a poor air quality day, exercise early in the morning. Because as I mentioned before, earlier with ozone peaks during the hotter parts of the day. So that's typically your afternoon or your evening between 12 and 7. So I would say get out first thing in the morning or later on in the evening if you're a person who enjoys outdoor activity levels. So that's one thing. Now, on a very poor air quality day, if you're a person with underlying health conditions such as asthma, we would say limit your time outdoors, aside from, again, first thing in the morning or later in the day, and then moderate your physical activity levels as well. You're the expert of your own body. So if you feel as if, you've overexhausted yourself, then, make the decision that best supports you. I think we've all become familiar during the pandemic of wearing of a mask. If you are comfortable with wearing a mask on a poor air quality day, especially if you have to go out during those peak days or during the peak times where ozone pollution may be higher between, again, 12 and 7, then you can wear a mask to reduce your exposure to that particulate matter. And then especially if you have a family, or maybe, again, you're just a very active person, you may not always want to stay indoors. So what we do recommend, if you still just want to be active, visiting your local recreation center, your libraries, museums, your bowling and arcade. So you're still able to get outside your home and enjoy those activities, but you're just doing it within an enclosed space, so you're not exposed to pollution.
Good to know. And Marcus, what environmental factors had the greatest impact on your asthma, and how do you manage that?
I think a lot of it is exactly what was just discussed by Lisa and Kirsten. Every day I look at the air quality index. That's one thing that I check. And I mean, if it's above moderate, I don't plan on doing anything outside really. I think the other environmental factors that really play are internal, inside the house. I have HEPA filters in my bedroom to keep, kind of a safe space in the house. So if I do kind of get slightly flared, that I can deal with that. I think there's also, pollen and mold indexes or other things that I look at on a regular basis. And inside the house, I mean, I have to be very careful about fragrance free. Everything needs to be, ways. I'm very minimalistic in my house. I don't have dust catcher things. I mean, it's very basic, very simple. The more stuff you have out there, the more dust it's going to catch and more potential for causing indoor problems. So it's kind of boring, I guess, but it does give me a place where I can actually breathe, and that's ultimately what I'm after.
It's good to know. It's like you have to control your environment inside and outside, because some days when it's bad ozone, you want to make sure that your environment inside is suitable as well. And Marcus, you're also on the American Lung Association board. What resources does the American Lung Association have for those looking for training or other educational asthma information?
They have a lot, and going to lung.org and then just doing a simple search under asthma will bring up just a whole list of things that are available. Some key things to note is an asthma action plan. Lisa mentioned they have a template out there that you can go in and fill out, and that. They also have a Better Breathers Network. And one of the things I think is so important is it's one thing to be somebody who's dealing with asthma, but somebody who's a caregiver for someone with asthma, especially children, because it's a very difficult thing to see a child who can't breathe and not really know what to do. And these resources out there kind of give you a voice in a community of other people who are dealing with the same type of things, so you can understand and relate to others. But yeah, there's a lot of resources and videos out on that site that make it a little bit easier to understand what you're facing with asthma.
And this is one of them. So this has been a great dialogue. Let's open up the conversation to our viewers. You can submit questions in the Q&A button. We'll try to do our best to answer some of those questions. And we already have some coming in. So Kirsten, this one's for you. Carol wants to know more about open burning. What is open burning and how does it impact our communities, and how can people take action?
So open burning is essentially the burning of, it can be trash or it can be the burning of brush, especially as we enter in the fall season. In regards of what the laws are around open burning in your area, I would recommend you to check with your local officials, because open burning can be illegal, and especially during times of drought, it can increase the risk for a wildfire. In terms of what impact it can have on our health and our communities, is open burning, as I mentioned earlier, that can actually generate particle pollution, that PM 2.5. So of course, for a person who has asthma or any respiratory condition, if they are exposed to open burning, that can be a trigger and lead to an asthma attack. So I think we need to be mindful of how our own activities can impact the surrounding communities. And again, just check with your local officials if that's something that's occurring in your local community. We want to make sure that individuals are aware and the people who are responsible can be held accountable as well.
Thank you. And Shirley wants to know about the effects an asthma attack has on the body. Lisa, can you speak to that?
Yes, Carrie, I can. So when you have an asthma flare-up, you will cough, you'll feel out of breath. You're going to have a lot of mucus you're coughing up, and you're going to make a musical sound called wheezing. These are signs that you need to refer to your asthma action plan. The asthma action plan gives you step by step what you should do when you're having problems with your asthma. It guides you as to whether you need to increase a medicine, call your doctor, or go to the hospital. If left untreated, an asthma attack can lead to your body being unable to provide oxygen to your body and eventually failure of the heart and lungs. One of the most memorable times I've had as a respiratory therapist was one day when we tried but failed to resuscitate a 12-year-old with asthma. Asthma is treatable. To know someone's child died from a treatable disease is a very hard thing. Access to care and knowledge is essential for treatment of asthma.
Thank you. And Elvis and Joseph have a question. I think we've somewhat answered these, but it was about climate change and air pollution, how it can cause an increase in asthma. One thing I don't know if we've touched on yet is how climate change can impact the length of the allergy season. Have we touched on that yet?
Yeah.
I don't think so. Lisa or Kirsten, I know we talked about this before. Do you think one of you could talk about that? Because I think they're kind of getting to it in this question here.
Yes, I briefly touched upon it. So climate change, again, with increasing temperatures, that means that we're going to have longer allergy seasons. And with longer allergy seasons, that means that there's going to be increased frequency to environmental triggers, such as, I'm just using pollen as an example. And when obviously, if you have a longer exposure and increased frequency to those triggers, that can lead to more frequency of asthma attacks for individuals who live in those areas that are experiencing those increasing temperatures as well. And even in regards, so heat is one thing, but and just another environmental trigger such as mold. So going back to, again, if you live in housing conditions where maybe it's poor quality, so there's more likely that there's a presence of mold and other triggers within the actual household. Longer and stronger storm systems, because flooding, especially on our coastal regions within Carolina, that can still be a trigger. And again, it's a threat to individuals with asthma as well as other vulnerable populations, including children and individuals with underlying health conditions.
Okay, and I think we also answered the next question. How does one manage asthma during times of deteriorating air quality? But is there anything, Lisa or Kirsten, you want to add to that?
I will just add, because Marcus had made a good point, because I mentioned, what you can do outside of your home, but inside of your home, he mentioned the use of a HEPA air filter. So if you actually go to the EPA.gov, they actually have a great resource of how to create a clean air room, essentially. But that basically, if you get an air filter, a HEPA air filter, and of course, if you think about if you have open doors or windows, make sure that you close those doors and windows. So if it is a poor air quality day, those pollutants are not getting through your windowsill, etc. So make sure you have sealed off windows. But if you have an air filter, you can actually have it within a room that can be your clean room. And essentially, plants can also serve as a buffer. There's certain plants to do your research. I know during the pandemic, a lot of people became plant parents, and they took, a lot of joy in having a lot of green within their space. Green infrastructure, plants within our home that can actually reduce pollution as well. So I would encourage individuals to do their research and look into what plants may be beneficial within their household to reduce those exposures and make sure, of course, those same plants, if you have, pets, I'm a huge dog person, make sure those same plants that you may use are not toxic to your cat or your dog or any of your animals, because I wouldn't want them to be harmed either.
That's a good one with the plants. I forgot
Yeah.
about that. And Lisa, yeah, go on if you have anything.
Yeah, Carrie, I would just like to add, I think it's important to take this conversation back to your healthcare provider, your doctor, because if there's a lot of poor air quality days and it's limiting you getting out of your house and doing normal routine, there are some indications for different medications and combination medications. So I feel like having that conversation, create a question list, and when you go to your doctor, ask that question, because there are some medication options out there that could get you out of your house and more active, even on poor air quality days.
Okay, thank you so much, both of you. And this one I think might be for Kirsten, a follow-up. Tomaka, I hope I'm saying that name right, asked what is being done to better the air quality in North Carolina.
So I'll highlight Clean Air NC, the organization that we work with. So, and it's also mentioned in regards of in the American Lung Association State of Air Report at this time, only 1/3 of all United States counties actually have a federal air monitor. So when we even speak about checking the air quality index, if you go to airnow.gov, and you can type in the city or the zip code, it may give you a reading of what the air quality is in the area, but sometimes that federal air monitor that's referencing could be miles, it may or may not be close to you. So what Clean Air NC, what we do, we have a citizen science program where we provide it's called purple air monitors. It's a portable monitor or stationary monitor that you can actually install at one's home. So if you're ever curious of, what's the hyper local air quality in your area, that's something that we're increasing monitoring when we want to equip community members with a way that they can track the air quality in their own area. So that's one thing. At the policy level, for those who, we're obviously in North Carolina, you may have heard of the Carbon Plan. The Carbon Plan is an ongoing process. Just last month, there was 4 public hearings in Durham, Charlotte, Asheville, and Wilmington. Sorry, I was trying to remember the 4th city. So individuals had the opportunity to speak at the Carbon Plan to share their concerns about the proposed plan, because it's not final. And just for context, North Carolina Utilities Commission and Duke Energy are in the process of developing what will determine the future of the energy sector within North Carolina. So I would encourage individuals to research the Carbon Plan, and you can still submit written comments to give feedback, because we can actually influence that outcome. There's also the Clean Transportation Plan that is developing. Individuals can look at and just continue to advocate, air quality. We all, as human beings, regardless of race, color, creed, nationality, we need clean air. It's a human right. So we want to encourage individuals to continue to advocate for cleaner air. And the way that we can do that is just increasing more equitable air monitoring at the local level. And that's what I would recommend for individuals.
Great. And Joanna submitted a question. How does clutter and roaches impact people living with asthma? And Joseph wants to know about the effects of over-the-counter medications on asthma. Lisa, can you answer those questions?
So I think the first one was clutter. So I think that you can say that clutter probably does contribute to asthma. If you think about things being cluttered or inboxes or trash piling up, it's a breeding ground for cockroaches and mice, and that can definitely contribute to worsening of the asthma. As to over-the-counter medications and supplements, I think that there's some very good evidence that says they may benefit a certain population of patients who have asthma. I don't think you can just go pick and choose yourself. I really feel like that you need to, again, put this on your question list, take it to your doctor and talk to your doctor about this. For example, I've had asthma since a kid, and I take a vitamin that I feel like really helps my asthma, but I started taking that because I talked to my doctor about it, and my doctor tested that vitamin level, found out it was low, and that the vitamin would benefit me. So I definitely encourage you, take it to your doctor, ask the question before you start taking it. You don't want to mix medicines. It can actually have some really poor or bad outcomes.
Okay, thank you so much. And we do have a few more questions. I'll try to get to maybe one or two of them. I know we don't have a lot of time, but Rhonda, she said, can you discuss bronchiectasis? And she said she had it from living with smokers. I don't know if we've really touched on that, when your home environment can be a detriment to your health. Kirsten or Lisa, can either of you speak on that?
I think I can take bronchiectasis. So bronchiectasis is where the tubes inside your lungs are chronically exposed to something that is harming the lining, and they actually change the shape of the structures within your lungs. And because that is a permanent change, you get damage and a buildup of mucus. And with that mucus buildup, you're prone to recurrent pneumonias. There are a few known triggers. I feel like smoking is probably not on the top of the list, but I could definitely see where chronic irritation could contribute to that. Something that may be related is they feel confident that sinus infections, chronic uncontrolled sinus infections, can lead to contribute to bronchiectasis. And we know that cigarette smoking is an irritant to the nose and sinuses and goes hand in hand with recurrent sinus infections. So I think you could say that there is some correlation with that and bronchiectasis.
Okay, good to know. And I think this will be our last question. Angela, she has a question. I'm not sure if we can answer it, but she asks, how best to address rental agencies with having homes, apartment complexes that have issues with mold, dust mites, etc. She was wondering if there's any laws that basically can protect tenants if they're dealing with issues within the place that they rent out that could be activating their allergies. Is that, maybe Kirsten, is that something you can touch on at all, or do you not?
I do not have a legal background, so I don't want to misspeak and provide, any misinformation. But what I would recommend, if you are a person who you're concerned, you live, whether it's public housing or maybe you live in a community where your poor air quality is a recurring factor, you can visit cleanairnc.gov. We have an environmental justice program where we focus on communities that are disproportionately impacted by air pollution. And in terms of action items, aside from I mentioned earlier, equipping community members with air monitors where they can actually check what the air quality is. Just to give context, if you visit our website, we have worked with, it's Historic West End, which is Historic West End is a red line community within Charlotte. It's a community that is disproportionately impacted by air pollution as it's intersected by 3 interstate systems, Interstate 40, 85, and a major highway system, plus a hyper concentration of different industrial sources. So we provided, there's 3 community leaders within Historic West End. We provided purple air monitors. Purple air monitors tracked PM 2.5. And from them tracking their air quality, they actually written a report with the support of staff. And they actually share that report at the Mecklenburg County Commission. And during that presentation to the Mecklenburg County Commission, they actually requested if they could receive a federal air monitor to support ongoing monitoring efforts. And it just so happened that the EPA had available federal air monitors, so they actually did receive that federal air monitor. So it just goes to show how community members with equipped with the right resources, the awareness, they can advocate and be the changes that they would like to see in their community. So that's what role we can play in supporting individuals. And then of course, reach out to other organizations that can provide more of a legal aspect. But we are definitely in the space of advocating and equipping community members with resources in education so they can advance changes in their areas.
That was very good information. I'm sure that person isn't the only one living with that. So this has
Carrie.
been oh yeah, you want to add one thing?
Yeah, I just want to add two things. I would encourage this person to reach out to their county health department. Also, the counties tend to have a health board that meets, and I think either one might be a good resource for next steps.
Also good information to have. So thank you so much, Lisa and Kirsten. This has been a great conversation. Thank you all for attending today's Community Connections. I hope you found it informative, and a special thanks to our presenting sponsor, Novant Health. We are grateful to our panelists for their insight and service. Again, that's Lisa Cutshaw, Marcus Hill, and Kirsten Miner. Please remember to complete the survey. Your feedback is important to us, and check your email for a recording of this session and additional resources. That way you can go back. If you missed something, you can listen back to this. And we thank you again. We really hope you have a wonderful day, and thank you everybody for joining us. Bye for now.